Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Thank you for joining us today. You are listening to Mahaska Health Medical Minute. My name is Renee Edgar, and I'll be your host for this episode. And we're joined today with Patty Malloy, Public Health Coordinator at Mahaska Health. Of course, we have enjoyed talking with Patty the last couple of weeks. We know about her passion for preparedness, education, and training. She's truly our expert here at Mahaska Health regarding the COVID vaccination updates. Patty, I have a meeting this morning. How did that go with state updates? Tell us about that.
Yeah, the meeting was good. This one, we talked a little bit about vaccine shortages. So we know that every county in Iowa is kind of dealing with the same issues. We have a lot of people wanting vaccine, and we just need the vaccine.
Supply and demand. We know that we are close to 20% of Mahaska population being 65 plus. Where are you running into questions with those numbers?
Yeah, so we have roughly 4,000 people in Mahaska County, 65 and older, and a lot of those want the vaccine. So right now we're getting small allocations. We're giving those, to the 65 and older and to our Tier 1 workforce, which is our first responders, which includes firefighters, police officers, and child welfare social workers, and also includes our pre-K to 12 school staff, early childhood education, and child care workers. So that's, a pretty big group that we want to get vaccinated. Just February 1st was when we could start. We just know the vaccine will come in, each week, and we'll just work with what we have.
Truly, we are prepared. We're staffed, excited to open these clinics. Honestly, we're just waiting on our allocation. I know Mahaska Health is fielding some calls. Tell us about some of those calls, Patty, that you're receiving.
Currently, we are receiving a lot of calls, and we have a lot of people that want the vaccine, and that's great. We want people to get vaccinated. Currently, what we're doing when people call is we're getting you signed up for the Mahaska Alerts. This is the alert system that we use for emergency storms and other modes of, information to get across to the county. Mahaska Emergency Management has added a tab for public health COVID information. So when we sign you up for that, we'll ask you different ways. If you want a voicemail, if you want a text message, or it can come by email, or it can come all three ways. When you sign up, just know what number you want that to go to, and then we'll send out an alert. And we sent out alert this week just to kind of test and let people know you've signed up and we're ready to go. Once we get the vaccine, that will be how you get contacted that we are taking appointments. So once that alert goes out and tells you the information to call, our public health office, and we'll be making those appointments.
Prioritizing our residents of Mahaska County is ultimately, I know, your goal, Patty. I see that with you, working with you daily on this vaccine rollout. You truly have everyone's interest at heart. So that's amazing to see. Now, back up to the Mahaska Alert. We do know that is when that alert went out yesterday, that went out to everyone. That is not an age-specific alert. So regardless of your age, when you sign up for that, you will get those alerts across the board. Your plan is to send out an alert when we reach that tier and those recommended people.
Yeah, the state and the federal government have actually given us, the criteria of who can get it. Again, it's the 65 and older and that Tier 1 workforce that I just mentioned earlier. Those are who we can give it to right now because we are in a shortage order. And also one thing I wanted to mention is if you've been getting the storm alerts and the other alerts, you do need to go back in and register and click on the public health box. So if you're already signed up, just go ahead and go back in. You can get to that through mahaskahealth.org. There's a blue banner at the top and it says Mahaska Alerts. That will get you right to the link, and you can just sign up and click that public health box after you put your name and how you want contacted. If you're already receiving alerts, just go back in and make sure you have the public health one marked.
And you are truly receiving, your recommendations are strictly from the Iowa Department of Public Health. So you are releasing and vaccinating these patients according to what their procedures are. another phone line, an information only line. We do have the public health line, but you have been wonderful and have this line open for information only. This information line is wonderful. It's a great information for that person who doesn't want to call your call center. We've already signed up for Mahaska Alerts. Hey, where are we at in this process? So it's a great update for really anyone. Tell us a little bit about what's in that.
When we originally started the 75 and older age group, we quickly found out that not everybody has social media. The Facebook information is actually put on this information line. So the information line that we're just giving that information as another mode of communication to the residents that don't maybe follow Facebook or have access to that.
And that is 641-672-3445. One quick point that we really didn't talk about much, and I've been wanting to, is this population of grandparents. I really think this baby boomer age who wants to see their grandkids have been the most affected. I know, Patty, you're a grandma, a young grandma, I might add. What advice do you have for that person? That person who is wanting to see their grandkids. They know we're in short supply. They know their local public health is excited about getting these doses in. We know they're doing the best they can with prioritizing. We know it's going to be a little bit more of a wait for that grandparent. We know that's not ultimately, we know we're still going to have to social distance and wear our masks and follow all the procedures. But what advice do you have for that person in Mahaska County? It's 20% of us waiting for the vaccine and ready to see their kids.
Yeah, I know it's been a really long year and a lot of sacrifices have been made, and it's just patience, just a little bit longer. We're hoping that, soon we're getting more vaccine. We do anticipate this phase to last, through the month of February and into March. The vaccine is coming. It won't be as slow as it started. We're hearing that there's more being released, and so we really hope that we can see some more of that soon. So just patience, I think, with us here at Public Health. We're doing the best we can, and we want to get the communication, out to you, be transparent, but we're really at the mercy of where the vaccine and how much vaccine, where it's at and how much we have.
And how much is being released to us.
Right.
Your plan. What's your next step? What's your plan?
Yeah, our plan is we'll work with the 65 and older group and the tier 1, get through those teachers, because they've been working with a lot of the kids that are COVID carriers, and we just want to keep them safe so they can continue to work in our workforce, our police, and work through the different tiers in this phase 1B.
And ultimately, to get to that 65 plus range, you're asking they'll get the alert. We'll communicate through our Facebook page and through our website and the Mahaska County Public Health page. Is that correct? Anywhere else?
That is correct.
Perfect. Patty, again, the hours you put in and dedicated to the residents of Mahaska County is wonderful. Truly wish everyone could see what you put in every day and how much you want to help them and how much you want to get this information out and how quick you are working to do this. It's on your face every day when I see you. So I wish everyone had that opportunity. Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.